Hello and welcome, folks, to this 81st episode of the REBT Advocates with Dr. Michael R. Adelstein and me, Tommy Bateman. You can find Michael at 3minutetherapy.com, and you can find me, just by emailing rebtadvocates@gmail.com. Send us your concern, hate, questions. Go for it. We love it all. We love all of it, really, because that's our mindset. Today, I bet you're wondering about the title. What the heck does postpartum depression and breastfeeding, especially, have to do with REBT? Well, you're in for a treat. Michael, are you ready for this one?
Yeah, I had some thoughts about that, but I think you might have dealt with this more extensively. So my view of postpartum depression is that normally there's a strong hormonal aspect to it, but the hormonal aspect is just an influence. It's not a cause of psychological depression. Now, your body may feel depressed, that's hormonal. But if you're psychologically depressed, that means you have a demand, a must or a should or a have to about that. And often it's a secondary disturbance. I must not feel so lethargic and apathetic. I have to feel good right now. And that tends to magnify the physical lethargy and make it worse, and then it becomes full-blown psychological depression. So I think that's, from my perspective, that's a big picture on postpartum depression.
Yes, absolutely. So with that in mind, folks, I think that's a good framework to narrow it down to this discussion about breastfeeding. Yes, we're going to having two REBT therapists talk about breastfeeding. What the heck does this have to do with anything? Well, I'll tell you. In modern times, most recently, there's been a large push from postpartum doctors, from lactation specialists and things like that to say, hey, breast is best. That breastfeeding the baby leads to more nutrients, more antibodies, more you name it, that goes to the baby, especially that newborn. And they recommend about 6 months of pure breastfeeding, nothing but breastfeeding, and really pushing that agenda, if that's the way of putting it. There are research studies that say, hey, this may be more or healthier for the child to be doing breastfeeding, but maybe there's a problem there. Maybe with this push, some mothers are thinking, well, in order to be a good mother, I have to breastfeed. But sometimes some women can't breastfeed for various reasons. They don't produce enough milk, or it's too painful, you name it. There's reasons, or they just choose not to, right? But then they have the belief, I am not breastfeeding. Therefore, or I am failing to breastfeed. That's probably a better way to put it. I am failing to breastfeed. Therefore, I am a poor mother, and by extension, a horrible person. And what's the consequence of that? Maybe that depression and anxiety that we're talking about. And with the hormones and the hormonal changes after a childbirth that Michael mentioned, man, that amplifies that a little bit worse. Michael, what do you think about that?
Yeah, well, I think that this is an important illustration about how people work in general with societal standards. So often people will think there's a certain societal standard, which they may have dreamed up, that may not be, but it seems that way to them because some other people might think a certain way, like it's buy a new car, or buy a house, or these kinds of things. So we could say those are certain societal standards, and then they feel pressured to do that. But they're pressuring themselves. They are telling themselves, I must fit in, I must conform, I must have a new car, I must have a house, etc. And that creates that pressure. And that very well could happen with some mothers who are not breastfeeding, or even some mothers who are considering whether or not to breastfeed, and then they put pressure on themselves. I must fit in, I must do what doctors say is the right thing, although I'm sure not all doctors say that's the right thing, especially in individual cases. Everyone's an individual, and normally suggestions doctors give you are from studies, and studies give you group norms, and group norms usually fall on a bell-shaped distribution, and you may be in one of the tails, not in the center of the bell shape. So this advice may not be for you. But even if it is for you and you don't do it, or you're considering not to do it, that doesn't necessitate putting a must on it. I must do what would be good for me. And if I don't, I'm a horrible person, as Tommy is saying. You get it usually from a psychopathological must or should. You get a global evaluation. In this case, the should is on yourself, so it's putting yourself down. I'm no good. I'm a horrible person. I'm an idiot. And often I think I can't enjoy life at all this way. I'm a hopeless case.
Mm-hmm. And then, of course, it becomes a almost a self-fulfilling prophecy in a way that, you know, you've engaged in this in downward thinking, you've engaged in this musty, demanding thinking, and now you're experiencing postpartum depression, which of course hormones plus that negative thinking coming together is not helpful. And maybe then you're not being able to perform as a mother that you generally would like to. And then you think, oh gee, see, I'm still screwing up, look at me, this is what horrible mothers do. They do horrible things, they're horrible at paying attention to the child, they're horrible, and they just good mothers don't feel this way. Good mothers are loving this point in their lives. Good mothers are just feeling that warmth and that glow, and they really want to engage with the child. But all I want to do is crawl into bed or be left alone or run away or go into a psych ward. I don't know, but I don't want to do this. Man, I'm a horrible person, obviously, because most mothers are really good mothers, do something completely different. And the cycle goes on and on and on. Really, this, and sometimes, hey, it could be because I told myself I must breastfeed, I must do this in order to be a good mother, when really that's not true. And in fact, I'm not even going to get into the main studies, but because I'm not a medical professional, but apparently there's some debate on whether or not breast really is best. Maybe fed is best. I think fed is usually best, but hey, that's the side I fall down on. So we need to interrupt that mustiness behavior from the head on. Michael, I talked a
Yeah, it
lot.
would be preferable to interrupt the mustiness behavior. And another aspect of this, and you can see this from the first must, I must do well and get approval. And Tommy and I have been talking about the first part of the first must, I must do well, but very well could be the second part, I must get approval. And sometimes people put themselves down or put musts on themselves, not so much about violating society standards, but rather by risking disapproval. So if I don't breastfeed and other mothers who are friends of mine do, and they find out that I didn't breastfeed as I must, then they might disapprove of me, and I must have their approval. I must avoid being rejected by my friends, and that also leads to a global evaluation. If they do reject me, the should leads to a must. Albert Ellis used to say, shouldhood is shithood. So if you start with a should or a must, that leads to putting yourself down. So a few antidotes to all this is reminding yourself there are no shoulds, there are no musts, there are no bad, idiotic people. There are just imperfect humans who act imperfectly. There are people doing things, and sometimes we do good things, sometimes we do bad things, but through all that, we're still just imperfect humans, no matter what others think about us. So
Hmm.
the goal is unconditional self-acceptance, learning to accept yourself unconditionally, whether you do well or poorly, or people approve or disapprove of you. And if you are feeling guilty or anxious or depressed about breastfeeding or not breastfeeding, you can use this as a golden opportunity to practice unconditional self-acceptance. Practice self-therapy. Show yourself that even though others might be disapproving, even though I might be doing the wrong thing, and I never have an absolute guarantee or certainty I am doing the right thing, even if I'm not, this shows that I'm an imperfect human. So you can practice in action, not only in theory, not only cognitively, but behaviorally, unconditional self-acceptance.
Yeah. One last thing on my end. We just because too that this message is not meant for people that fail to breastfeed or choose not to breastfeed. This message is for people that are breastfeeding just fine. In fact, they're doing swimmingly well when it comes to the act of breastfeeding. Because if you still have that musty thinking that I must breastfeed well or else I'm a lousy mom, you're still putting yourself under immense pressure, doomed for perhaps a crash if you have a bad day or an off day. You're still feeling that pressure. All right, at least I'm breastfeeding, but man, I better keep on doing it. I better keep on doing it. And that's when that postpartum perhaps anxiety comes in, folks. So let go of that. Even if you're doing well when it comes to the physical aspect, that you're succeeding in the act of mothering or the act of breastfeeding, don't let go of that musty thinking. Do what Michael just suggested, unconditional self-acceptance. Michael, I'm done. I'm done.
Okay, very good. Thanks for bringing up the topic, Tommy. I think that it was a great way to illustrate some of the main REBT, rational emotive behavior therapy principles. And if you enjoyed this episode, please comment and support us on Patreon, give us a like, and subscribe to the REBT Advocates to stay on the rational side of life.